So I chose the healthcare field to better myself and to advance, actually just to help people. And so I chose a long time ago, this is about 10 years ago, I've been doing this, retail first, and then I went into the hospital. And the hospital, I feel, is a little more rewarding just because people, they didn't choose to be there most of the time. It was by accident or life-threatening. So I feel like it's kind of more important to be there. And I really enjoy what I do, helping people and getting life-saving medicine to people, especially during this time, is huge, I think. And just being there to help nurses and whatever help they need. And I think healthcare is huge. It's very important right now. And I feel sometimes pharmacy gets forgotten in that field, and people forget that we're in there with them. But pharmacists are a very important role they play in healthcare and the patient's overall well-being. They monitor and check patients' medications, obviously, and make sure they're on the right stuff, and if there's something that needs to be adjusted, they're there to help them. And so when COVID was first announced, it was pretty scary just because we didn't know how we would react and how we were not really prepared for such an increased volume of patients and just the steps we had to take to be prepared. And what was needed in our stance of what was needed for medicine. Things started to go on shortage because people started realizing what they needed to handle it. And so we were trying to order as much as we can for those patients and making sure that we had enough on hand so that we wouldn't run out. And then it got to the point where we didn't have enough PPE, and it just got scary in that sense. And so we started having to resource and find other locations that had it, and then just kind of pull together and figure out what was best for everyone. And I think my company did really good started asking people right away, are you exhibiting any signs? We need to make sure everyone's wearing masks. Let's start temperatures, checking. They started doing that right away to start easing people in and making sure that people, if they were feeling sick, they got taken care of right away instead of spreading. And so that was really, I think, great that they started that so soon that it seemed like everyone was trying to catch up to us, because other people would be calling and be like, well, what are you doing for this? And we're like, well, we've been doing this. And so it seemed like we were kind of the leaders in that a little bit in our field, I feel, because other hospitals were calling and saying, well, what are you doing for this? And we'd be like, okay, well, we're doing this. And we had great sister hospitals that would ask us questions, and then we'd get feedback, and then we'd be like, well, what are you guys doing? So it was coming together. Everyone was trying to figure out what was the best thing to do at that time. I feel like I was okay. I feel like I was moments scared because I didn't know if I was walking into a cloud of virus. As they said, it was in the air. And so I was like, oh my God, it's everywhere. And then I was like, wait, we have stuff in the air all the time. And I'm like, I'm still gotta do my job, and I still gotta get through this. I feel like I wasn't as scared as I feel some other people that were more on the front line. And I feel like if I had to go into a patient's room, I would have had more fear, definitely. And I could see it in the nurses' eyes that they were scared, and they were really scared to take it home to their families. And I was scared too for that. I didn't want to give it to anybody else, and I still don't. I still am really scared that I don't want to cause anybody else harm, and that's not what I'm here for. So now it feels like we have a plan. Before, I was kind of up in the air, but now I feel like we're coming together. We know what we're doing. We know how to handle things a lot better, and I feel like people feel a little bit more comfortable. I think patients feel comfortable more to come into the hospital. Before, they were so afraid. Now I think that people are getting better about coming in. They're not so scared. And so that's important, because we want to give that patient care. We don't want them to be afraid to come to the hospital. That's what we're there for. The community came together really good. we had so much support in our, like, just our area, but throughout the whole city of Denver. Like, every hospital had great news. Like, people were bringing food. There was, like, restaurants donating catering. They're doing that for us. There was signs. There was signs all over the building, like, superheroes work here. We love you. It was really tempting. Just to see everyone come together, because I've never seen that before quite like that, and I think that's new for everyone. And so, like, they're like, superheroes work here, and I was like, I don't feel like one. I don't feel like a superhero, but I'm glad they see me that way. And I was just like, wow, this is really cool. It's cool to see, like, kids were drawing on the chalk, like, we love you, be careful, and it was just really cute. People don't wear signs that say, hey, I need help. And there's people, nurses that go through that are, like, struggling. They know they might have just lost a patient and they're struggling. And so, they just had to stop at the store to get something, and they just feel like crap. And it's just being kind, just looking out for signs too. Like, if you see someone struggling, like your coworker or something, and they're having a rough time, just maybe saying something, just seeing if they need help. Like, it's hard. A lot of people on the front line see a lot of things every day that's scary.
That's really good. Thank you. Thanks for coming to
Yeah,
the
of
studio
course.
and for trusting me.
Yeah.
If there's one thing you can say about the way the United States or America reacted, what would you say?
I think overall, our country's really scared, and I think, like, it's hard to explain, because you have one half that are just trying to make it survive, and then there's the other half that it seems like they don't care how the other half lives, and so it's a giant tug of war of trying to be consistent and trying to show that we're all human. And so someone might overreact to something that's not a big deal, or sometimes it's a big deal and people don't overreact. So it's a very fine line of trying to get people to come together and, see that there's overall good, and, we will get through this. It's just, we got to figure out how to come together and figure out without fighting over someone not wearing a mask. That's not fair. And then, people that do wear a mask getting bullied and made fun of. It's just like, we gotta come together. We gotta figure out how to overcome this without tearing each other apart. Like, I feel it's like every day, like, you have people that are going through stuff and you just don't know, and it's hard because you want to help, or you can, like, see people and you know that they're having a rough day, or sometimes you can't even tell, like, they hide it so well. But it's just be kind, because there's so many people that are going through the struggle. Either they're working the front line and they're scared, or they just found out that someone that they love got sick, and so they're going with that, and so they're just trying to get some groceries or just get out of the hospital, so there they are buying their essentials. So it's just being kind, so hard to know, because people don't wear signs that say, hey, I need help. And there's people, nurses that go through that are, like, struggling. They know they might have just lost a patient and they're struggling, and so they just had to stop at the store to get something, and they just feel like crap. And it's just being kind, just looking out for signs too. Like, if you see someone struggling, like your coworker or something, and they're having a rough time, just maybe saying something, just seeing if they need help. Like, it's hard. A lot of people on the front line see a lot of things every day it's scary. We will get through this. It's just, we got to figure out how to come together and figure out without fighting over someone not wearing a mask. That's not fair. And then, people that do wear a mask getting bullied and made fun of. It's just like, we got to come together. We got to figure out how to overcome this without tearing each other apart.
That's brilliant. Thanks, dear.